Next tonight here on this live edition of 2020, fighting fears on the front lines and right in the hospital emergency rooms across this country and here in New York City. And I want to bring in ER Dr. John D'Angelo, who's in charge of preparedness at the emergency departments at 18 affiliated hospitals here in the New York area. Doctor, thanks for joining us tonight. And I wanted to get right to the bottom line here. There's been so much talk about whether or not there are enough testing kits around this country. Do you have the test kits you need tonight? And are people allowed to come into the ER to get tested? And if so, who are you deciding to test?
So currently all the testing is being done through local health departments and the CDC. The test kits have been released this past week, and those kits were needed for our labs to start preparing to be able to run the test ourselves. And that's a process that takes validation and setup of the lab. So we're hoping by next week to do our own testing. So at the moment, no one's doing testing other than the state and local health departments.
That's really interesting.
That's limited our ability to test.
Yeah, Dr. D'Angelo, so what are you seeing in the ER so far? I'm sure there are a lot of nerves, and you have to balance who you treat and who you suggest to be tested when they do come into the ER. So how are you gauging that?
So all decisions to test are being done in conjunction with speaking to the Department of Health, and at this point mostly being reserved for those at most risk for severe disease. So those with mild or moderate disease, a mild flu-like illness, to date we haven't really been testing. We're just giving good instructions on home isolation and how to manage themselves. But the testing's really been reserved for those people who are at most risk.
Doctor, I know you are prepared every season for the most severe cases of the flu, the people who then present in the ER. Are you seeing anything atypical, though, right now? Or do you think you're already starting to see the beginning of this here in New York?
Yeah, we're already starting to see the beginning of it. There's been a few cases in the area, as you know. It's not been overwhelming yet as far as volume is concerned, although there's a lot of anxiety out there. But we are starting to see cases.
Dr. John D'Angelo with us tonight. Dr. D'Angelo, we appreciate what you're doing there on the front lines. And I want to bring this question back to Jen, because how do you know when it's time to get to the emergency room or to your doctor right away? We mentioned the temperature of 100.4.
Right.
But what else should you be looking for?
Well, I think the really important thing, David, is people shouldn't try to be their own doctor or nurse here. So you should be, in communication with your doctor. But I was just talking to Dr. Simone Wiles. You're an infectious disease specialist from South Shore Health right outside of Boston. Tell me how you're advising people to kind of go through that decision, whether they should stay at home or whether they should come in.
So the patients that we try to get into the hospital are those that have symptoms. And by symptoms, I mean very hard time breathing, very high fevers, having a hard time taking care of themselves at home.
Right.
So you want to come in because we want to assess you to see how you're doing.
And certainly, obviously, someone with a weakened immune system, who's pregnant, with any chronic or pre-existing medical conditions, those are people that you want to see in the hospital.
Absolutely.
Yeah.
We don't want them to be at home.
And I think it's really important also, David, to remember that these ERs are treating patients with heart attacks, strokes, accidents. And so it's a balance between taking care of someone who might be sick with a virus and taking care of the patients that are always packed into ERs in general. So,
Thanks to you both and the whole team over there. More questions to come.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.